This is Daisy. She's an 8-month-old puppy. My name's AJ. I've been a pet groomer for 16 years. Daisy has a little bit of an ear infection. We're going to go ahead and do what we can as a groomer to help it clear up, clean up, and get it treated. I'm going to do everything that I need to make sure that she can get a treatment, that it can clear up on its own. So it can be difficult to know if your dog has an ear infection, but there's 4 main signs that I look for to know if they do or not. Greasy, grimy earwax is always present when there's an ear infection. Now, it alone does not indicate that there is an ear infection, but it's always there if there is one. Second is swelling, redness, and irritation inside the ear canal and at the surface of the ear. This is always present when there's an ear infection. And generally it's not a thing if there's not an ear infection. So this is one of the signs that if there is redness and swelling, then generally you do have an ear infection that you're dealing with. Third is going to be a smell. When there's not an ear infection, there is a smell. But when there is an ear infection, it smells bad. And it's a much stronger smell. Fourth is going to be itchiness. The dogs will sometimes be very itchy if there is an ear infection. If you see your dog scratching their ear or rubbing it on the ground, carpet, couch, anything like that, then there's a possible chance that they have an ear infection. Itchiness alone does not indicate an ear infection, so that's one of those that it has to be coupled with the other symptoms. How do you prevent an ear infection? The best way to prevent an ear infection is to shave the inside of the ear, pluck and remove the hair from the inside of the ear canal, and regularly clean the dog's ears. This allows light and air to get inside of the ear canal, and that will kill the bacteria, yeast, or fungus that is causing the ear infection. Remember when I said inflammation is the biggest issue with an ear infection? That's because it closes off the ear canal. And plucking the ears when the dog has an active ear infection can make this inflammation worse. So if there is an infection, sometimes you do not want to pluck it if you don't have to. In certain situations, the hair is so thick and matted up that it is actually preventing light and air from getting into the ear canal, and it will also prevent the medication from thoroughly spreading on the inside of the ear canal. And in those situations, the hair needs to be removed in order for the medication to do its job. Now this is Daisy's first time, so we might need to do a little desensitizing. She might panic when I turn that clipper on. Let's go ahead and test that. Good girl. She did wonderful. Did not react too much, so now I'm going to get her into the view. We're going to shave the surface of the ear canal. I'm being very careful of this flap right here. It's hard to see, but there is a flap of skin that can be easily nicked right here.
The ear flap is this small little section on the right-hand side. If you're not careful, bringing the clipper straight down can catch the edge of the ear right here, and that could nick it. Or if you were coming straight up with the clipper, you might be able to catch this edge. So the safest way is to stay inside of the ear where the edge of the clipper is completely away from the ear flap, or to shave away from the ear flap altogether so that neither edge can be caught in the clipper blade.
And in this situation, I believe she does have a minor ear infection. She does not have very much hair in the ear canal. So we're just going to clean up the surface, and we're going to clean the inside. We're going to take our cotton ball with ear cleaner and rub out the inside of her ear. Use a second cotton ball. Try to get this down in this fold. Get another cotton ball. This one's still pretty dirty. Starting to come clean now. It's just in that back crevice where most of it is. So we're going to use Q-tips now. At this point, I think a lot of the wax is stuck in the hairs that are in the corner of this ear. And I would like to pluck these hairs, but I do not want to pluck while there's an active ear infection if I don't have to. We're going to recommend that they get an ear infection treatment for this dog, and then they come back in and we'll pluck the hair, and honestly, she needs a groom. Now, just from cleaning her ears, there's a little bit more redness, which indicates inflammation and irritation. That's just from cleaning it, just from rubbing a Q-tip and cotton ball on there. You can imagine how much ripping the hair out of there would cause it even worse. Now this ear's all done, we can go ahead and get the other ear. A little bit more hair in this ear now, but it does not seem to be quite as dirty as the other side. Okay, pretty clean cotton ball. We're going to use a Q-tip to finish it up. Get in all the cracks and crevices. So the safe way to use a Q-tip is to know that the ear canal goes down and then in. And so as long as my Q-tip is either pointing straight down, and as long as I don't go in, then that's how I would make a mistake, is if I go in. So if I am going straight down, or if I am on the outside and the surface of the ear canal up here, I can go in right here. That's not going inside the ear canal. This is still on the surface. Versus right here, the Q-tip is actually in the ear canal. And I'm making sure that it is pointing straight down to avoid going inside and touching the eardrum. There's a good amount of hair in here, but it's not too much where it's preventing light and air from getting in. So I don't believe that we need to pluck it today. We need to get a treatment and then pluck it after the infection's cleared up. Okay, that's pretty good. Daisy needs an ear infection treatment, and then it should clear up just fine. Thanks for being a good girl, Daisy. Can you give the camera some love? Can we give the camera some loves? Oh yes. Oh yes. Okay, girl. Good job, baby.